We, as MS patients, only go to the neurologist a few times per year. Waiting in the waiting room, it can be overwhelming, scary, daunting, especially if it's your first time and you don't even feel well. I am an MS patient just like you and a pharmacist. So grab a pen and paper or whatever you use to remember things, because I'm about to give you 6 tips to have a meaningful visit with your neurologist. The last one is probably going to surprise you, so stick around to find out what it is. Number 1, arrive early. 2 things need to happen before you actually see your neurologist: the multiple sclerosis functional composite and questionnaires. They're very important in helping your neurologist develop a specific clinical picture to monitor your disease and to capture everything you need to talk about during that visit. The multiple sclerosis functional composite is a 3-part assessment used to measure the functional limitations associated with multiple sclerosis, or MS. It consists of 3 components, and you can think about it like this: your legs and feet. That's the timed 25-foot walk. This test measures walking speed and endurance. Next, arms and hands. That's the 9-hole peg test. This test measures hand dexterity and fine motor skills. 3, your mind. That's the paced auditory serial addition test, or the PASAT. This test measures cognitive function, specifically information processing, speed, and working memory. In addition to the MSFC, neurologists also use other questionnaires to assess various aspects of MS, such as Expanded Disability Status Scale, or the EDSS. This scale rates the overall level of disability in people with multiple sclerosis. The Multiple Sclerosis Quality of Life questionnaire. That's the MSQOL. This questionnaire measures the impact of MS on a person's quality of life. Thirdly, the Fatigue Severity Scale, or the FSS. This scale measures the severity of fatigue in people with MS. Fourthly, the Depression Scale. This scale measures the presence and severity of depression in people with MS. The specific questionnaires used may vary depending on the individual neurologist and the patient's specific needs. Doing these tests early does not cut into the time that needs to be spent with your doctor face to face. These tests can take approximately 15 minutes to complete. The second thing, bring an updated medicine list. You need to have the name of the drug, the doses, the route of administration, and the frequency of all drugs. All of this information can change from visit to visit. You may have multiple doctors if you have multiple things that are wrong with you, or better known as comorbidities. And all of these medications need to be accurate and up to date before your neurologist can prescribe anything else. Suggestion: you can use the Notes app in your phone. Number 3, bring your ID and insurance card. That's specifically in the United States. By the way, if you can list one thing you've learned so far, and I'm doing my job, you can press the like button. If you can list 2 things you've learned so far, can you hit that subscribe button? Because I am adding value with video, and I will continue to add value to you, your family, and your friends every week. Number 4, bring a list of all of your questions. I and my husband make running lists of anything that has changed, and we share back and forth before each visit. Number 5, bring your team, your warriors, your support staff, your village. Bring someone or people with you, your spouse, your friend, etc. If you need some help, you can reference my video of how to be a friend of an MS patient. My friend went with me to my visits sometimes. Even though I am a pharmacist, I'm also a patient. It's very helpful to not only have the physical presence of someone with you for support. They may hear something or process something or ask something you don't think to ask. Number 6, what are you going to wear? You don't want tight, restrictive clothing, because some of the neurological tests that are done require you to stand, to walk, put your finger to your nose, or move your arms. You need room to move. Getting the most out of your visit with your neurologist is so important. If you would like to learn how to be a friend of an MS patient, watch this video. Thank you for watching, and I'll see you in the next video. Thank you.